Hello, welcome to Dog Hugs. Robbie, Shaelyn.
Hi, everybody. Hi,
And Spider.
You know, when I first adopted Spider, quiet, buddy. He's still pretty crazy. Yeah, when I first adopted Spider, can you believe this? 5 years ago.
Oh my
We
gosh.
could barely touch him. In fact, our veterinarian needed 3 veterinary technicians
Oh my
just
gosh.
to examine him.
And I've trained dogs like that. Veterinarians have called me and said, Shaelyn, we are not going to let this dog back into our office until he's spent some time with you.
Nice.
Oh wow.
Well, today we have a very special pet holiday, and it is National Vet Tech Week.
Yay!
Yay!
We love our vets. We should
Amen.
we just on call them honorary vet nurses for now.
Oh, I like that.
Yeah. In fact, the interview, once we get into our interview, you'll see that there's actually a movement afoot to really change how we think of veterinary technicians
Oh wow.
and veterinary nurses.
Super
Big-
important.
Yeah.
Big change. Well, here's an article at the Positively Woof website. It's an interview with Dr. Lisa Eshman, who is head of the veterinary technology program at Foothill College in Northern California, and a whole article that Robbie did on Vet Tech Week.
Amazing.
So, yeah, today we have a student and another instructor from the Foothill College Veterinary Technology program. So in a moment, we're going to get right into that interview, and which you're really going to love. But it went so well. It went so well. We recorded this interview yesterday, and it went so well, folks, that we just decided to let it roll and keep it going. So in a moment, you're going to hear, an extra special double interview here with those folks. And but before we get into that, we want to express our gratitude for veterinary technicians and our shelter shout outs so that you can just sit back and enjoy the show. We hope you'll comment also with some shout outs to your veterinary technicians.
Oh, that would be
who work in
great.
your veterinary office. Yes, please do join in the chat. So before we get on with the interview, come on down here, little buddy. Atta boy. Is there a shelter shout out, some gratitude that Geraldine, Robbie, you'd like to express today?
My heart goes out to all veterinarian techs and all shelters right now, because so many vet techs work in the shelters, obviously, as well as the veterinarians that work in the shelters. So I'm a combo package here. I want to say both. They work so well together, and you'll see today that both of the people that we interviewed work with shelter and a veterinarian office. So, or now Shae, she's an instructor now, but for 20 years, she was involved with rescue and a shelter. Amazing. And a veterinarian's office. And the work that they do is, my heart goes out to you. I cannot even begin to thank you enough for everything you've had to endure to help save lives. Oh my goodness, bless you. I love the fact that you are so dedicated to that you continue doing it. And thank you.
Robbie, how about you?
Since it is Vet Tech Week, I have spent so much time at my veterinarian's office recently with everybody's annual checkups come at the same time. Then Archie was sick and Murray was sick. But my vet techs know me by name when I call up or by the sound of my voice. And my animals go to my vet techs just as much as they go to my vet. They trust them, and it's like we can get out of the car because they come to the car now because of COVID. They come to the car, I open the door, and I hand my pets over, and they're just as calm and relaxed with the vet techs as they are with my vet. So I absolutely love everybody at Barry Animal Hospital.
Mm.
And they also do a lot of work with our local, I don't remember, I want to say
rescue organization.
yes, but
Yeah,
it's
they
like
don't have a
it's
physical
the Orleans
shelter.
County, the Orleans County one where the rescue and shelter. But yeah, it's like they're so great there.
And Robbie, you're such an amazing rescuer, whatever you want to call yourself. You dedicate yourself you dedicate yourself to the cause and enjoy the life in front of you. And so many vet techs do that, and that's what keeps us all going.
Yes, it is.
I'm going to pile on here and again thank my vet techs at Sherman Oaks Veterinary Hospital here in Los Angeles, and who also do shelter work as well, and also the vet clinic at Pet Orphans, and the folks there who do such a great job. All right, kids. Well, now you are going to get to enjoy something really special. Here we go with an amazing interview with the great folks at Foothill College, and away we go.
Where's our sound?
I was just going to ask.
No sound?
No, we have no sound.
Okay.
I like to.
Is there sound?
To explain what it is have.
All right, I'm going to start it again, kids.
Humans.
Here we go.
Welcome to Dog Hugs, Shaelyn and Yaneli. Tell us what a veterinary technician does.
Can I go first, Yaneli?
You can go first.
So one of the things that I like to, a way I like to explain what a vet tech is have everybody think of what a nurse does for humans.
Nice.
So everything, including nursing care, giving medicine, and then I say, okay, now think about what an anesthetist does. And so they induce anesthesia, they monitor anesthesia. Then say, okay, now think about what a radiology tech is. And so we take x-rays and we do ultrasound, and then respiratory therapy and pharmacy assistant and all of those kind of things. So even though I know that it probably upset some of the nurses, I kind of think of vet techs as nurses on steroids. We do everything a nurse does for humans, and then we do more. And then I usually ask people, okay, so how many species does a human nurse have to work with?
I think one. I'm hoping one.
Right. And so it's just
one species, which seems like two species sometimes, right?
Yeah, and sometimes I throw in pediatrics, so the tech, if you want to include them as a second because they're so different. And then I ask, okay, well, how many species do we have to deal with? And, we're looking at dogs, cats, horses, cows, pigs, chickens, avians of all species, reptiles of all species. So it really does take a lot of education and know-how to be able to be a nurse. And really, depending on the clinic that you're working with, one minute you may have a cat coming in for a dental cleaning. So you have to be a dental hygienist and a dental assistant. And then the next minute you have a snake coming in for being egg bound. And so now you have to be an anesthetist for a reptile. So there's a lot of different pieces that kind of incorporate what it means to be a veterinary technician.
Well, and throw in the caveat, those animals don't speak English, right? You have to be able to read their minds and their body language literally. And you don't even always know them. You know the ones that come in on a regular basis, but in the emergency room, you most likely encounter 7 out of 10 dogs or cats or animals, species you do not know very well.
Right. Absolutely. And so I think, you incorporate that. And then you also incorporate the fact that a lot of times we're doing procedures on our patients that have no idea. So they're fearful, they're aggressive. So not only do we have to perform our job to the best of our ability, we have to do it in spite of our patients trying to bite us and trying to scratch us, and not willing to have us touch them. So it can be quite challenging, and it can also be quite rewarding.
My dog Spider, when I first adopted him, required 3 technicians just to have him examined at the veterinarian. And now we perform dog tricks in the waiting room. It took a long time, and I think the testimonial I'm proudest of is from our veterinarian, who said he's now a completely different dog.
And you should be proud of that, Larry, because
Thank you.
so many veterinarians, when I lived in Las Vegas, veterinarians would call me and say, Geraldine, this dog's not welcome back at my office until it's had 4 visits with you. Like we can't deal. And it's harming the pet's well-being and the people's well-being by coddling or being an enabler for this behavior. So yes, definitely a must for peace of mind.
Thank you. Yaneli, you're now in training to be a veterinary technician. What's that about?
It's a lot. Like she was saying, there's so many different species, and so I'll think that we'll have a class and we'll have all the information. I'll familiarize myself with like canine and feline anatomy, and then they'll be like, okay, now study horses. And so it's
Just
a lot.
as you think you have it mastered, here's a whole nother technique.
And so it's a lot of information, and I really enjoy. I genuinely, it's so exciting going to school and like learning all of this, and then having it mostly be supplemented by the work that I'm doing. I really, really, really like it. It's just a lot of work. And then learning, like 2 years ago, I didn't know what a veterinary technician was. And then every day, like learning new tasks, like not only within like the traditional clinical experience where, like Shae was saying, we have to deal with medications, you have to deal with x-rays, with anesthesia, in addition to like general patient care. But also like in different parts of the industry, like if you're a large animal tech, or if you do like zoology or behavior, like there's so many different aspects of the field that veterinary technicians can like be a part of.
Do you have a favorite part?
It's all really fun and exciting right now. I really like the physiology and like clinical pathology, and I mean I can go on and on and on, but every new thing that I learn, I'm like, oh, that's my favorite now.
It's fascinating, isn't it? There's so many fingers in terms of directions you can go. So yes. Do you have a favorite part, Shae?
I have to say, hands down, my main job is as an instructor, and my favorite part, hands down, are the students. One of my favorite things to do is when they get to seniors, when we're in anesthesia, that's our capstone class. And so you have all these students that have been working on the field, and they just know so much, and they're so excited about what they know. And I'm pretty lucky. I kind of teach them throughout almost every quarter I have them. So I usually will pull out one of their quizzes from their first year and their first quarter and show it to them. And they're so embarrassed by how little they know, but then they're like super impressed. So I love watching them just grow and find that passion and become amazing technicians that, you know, I tell them all the time, my goal is for every student to graduate our program and me feeling comfortable putting my animals' lives in their hands. And it's such an amazing thing to be able to watch them grow and be able to feel comfortable having them run anesthesia on my animals.
So tell us about this initiative.
Yeah, so there's the Veterinary Nurse Initiative. And so what that is basically we as veterinary technicians are trying to come together and create a nationwide standard of education and care, and then a definition, and then really use, hopefully our hope is to be able to use the nurse name. What we find is kind of, as you guys pointed out, not a lot of people really understand what a veterinary technician does. Usually during my outreach, I'll ask the kids, well, what do you think it is? And most of the time I get responses that, you know, we work on machines, or we, you know, do lab tests and stuff. And so the idea is people have a better understanding of what we do if we are able to use the term veterinary nurse. And one of the challenges that we face in our field is just not an understanding and a lack of appreciation for what we do from the general public, because it's just, you know, we're kind of like the people in the background that not a lot of people talk about and know about. And so that's kind of the hope, is to get us the notability and the respect that we deserve as veterinary nurses.
Thank you. That really helps me understand it. And Geraldine, as you pointed out, you know, you, even before we started this topic, talked about, you know, the respect that and should be called nurses. Were you familiar, Geraldine, with this initiative? I wasn't.
So I knew that they were going to start one years ago, but I hadn't been up with the times that they had started one, and I knew that it would. So I had faith in that fact. But so many times I've had customers call me and their pet's 5 minutes from death, and I call my vet, and my vet tech answers, and I say, be ready. In 4 minutes, this is what's walking in the door. And they are all ready. They save the pet. They're angels. And I just don't think they get the respect they deserve. Also, think about it this way. You know, hospitals are massive. There are way more people than there are pets. People have usually way more problems than pets. So the pool to be able to draw from to pay nurses and to set up these massive organizations is completely different than a veterinarian hospital. They're smaller. It's just as expensive for the equipment, sometimes more expensive. So how do they pay the help? And the help is what helps really keep the place running. And I just think all of that needs to be refocused into where the priorities lie for who is really taking care of business. And veterinarian nurses are taking care of business. They should be recognized for it, and they should be compensated for it. And I bless them for I know what they go through. I've watched it, I've been a part of it, and I just bless them for all that they do to help bring people back and pets back to life, because that's what they do. I mean, when your pet passes away, you just lose your breath for a very long time, and it all helps save so many people through their pets. It's amazing.
So, I think, like, in that regard, in the like recognition and pay and compensation, I think there's a lot of really good work being done around unions, actually. And I feel like unionizing would be a really, really good way to, like Shae was saying, like standardize the practice, because again, I haven't been in the field long, but I can see how it gets in such an intense field, how it can be really isolating, sort of, because it's so busy all the time. You put so much physical labor in, and to have a network of individuals from different parts of the country, from different practices, that not only know what you're going through, but to have some sort of coalition building, where vet techs are dictating, like, hey, this is what we need to stay in the field longer. This is what we need to, like, feel like this is how we'll feel appreciated. I think would be really effective. And you can build coalitions like with other allied health fields and with other industries. And I think that would be one way to.
That's really savvy.
Very.
I'm impressed that you're speaking in those terms, Yaneli, and quote unquote only a student.
Thanks.
Professor, that must do your heart good to hear your students say that stuff.
I mean, you know, you know, she's a horrible person. She's a horrible student. She's just, I'm, to be honest, I'm a little embarrassed. She's a rock star. And I think that's one of the things that's so exciting about what I do is we have so many students that, you know, one of the things that people tend to forget is each of us come with our own history and our own life and our own knowledge of things. And what I tell students is the only thing different between me and you is the fact that I've been a tech for 20 years. but they have this amazing body of knowledge, and it's really exciting to be able to tap into that and interweave that into veterinary technology. And I think, you know, Yaneli just demonstrated that perfectly.
You're so lovely, Shae, to help support so many people that touch so many people's pets' lives. That's incredible. And Yaneli, kudos to you. Do you guys have a most interesting case that you've ever dealt with through all of this? I'd love to hear. I've had my share. So I just, my own customers. So my phone at 3 in the morning, I'm like, oh my God, how did that happen? So please share. I'd love to hear.
Mine, I haven't been in the field very long, but a couple of months ago, like an Australian Shepherd type dog came in that the owners told me was in the pool all afternoon, and it would like gulp down water, and it was kind of ataxic and unsteady on its feet, and it didn't look super off to me in the car, but I took it in because they seemed really worried. And as soon as I put it down, you could tell something was definitely wrong. And it turned out that it was the diagnosis that the doctor came up with was water toxicity. It had drank too much water, and I knew, like, in theory that could happen, but to see it in front of my eyes, to see the effects of it, and like they did a blood test and the electrolytes were completely all over the place, and to see the effect of that, and then how it was treated, and the dog was totally fine and went home a couple of days after. It was really, really cool to get into the specifics and to I guess, I don't know, like I could never think that like drinking too much water, like you could get sick and that I would ever see something like that. But it was really cool to see.
I'm so glad you brought that one up, because that's a monumental one in terms of something people can pay attention to their pets for every day. I have to monitor my pet's water every day. Otherwise, they would be in the hospital because we work out so hard. Well, we work out so hard. I have border collies. You have to work them out hard, or you might as well just sayonara to your baseboards and your shoes and your couch and probably your car if you take them anywhere. They are notorious for being nervous if they are not worked properly. So I work them out pretty hard every day, and I monitor how much water they drink at once. So thank you for bringing that up, Yaneli, and I hope that other people, as at least one takeaway today, are more mindful of how much and how quickly their pets drink water. I make sure their bowls only have enough in them. I don't fill them to the top. I give them a specific amount so they can have that amount at that moment. And if they need a little bit more, they get more in a half an hour or an hour. They do not get more immediately. Otherwise, they just wreck their system. They're so small. And if you think of me, just imagine me taking a massive 5-gallon bucket and drinking the whole thing at once. I would die. I would die because it would not only drown me, but it would wreck my electrolyte system and just my whole, quite a few other systems in general. So great. So Shae, give her an A.
Yes, please.
Absolutely.
Favorite case?
Shae.
I think
most memorable.
Well, I think obstructions are always super interesting and super memorable. Just so just what the crazy things animals will eat. But I think my all-time favorite, just really interesting, was a dog who was at the park and had swallowed a ball. So we brought the dog in and we did x-rays. And this is way back when we actually did film x-ray. And so we had a processing room in the dark room. And so I was helping with the x-rays and holding the animals. And so one of my coworkers was developing the film. And as he's developing it, all of a sudden he just yells, "Holy crap, it's an elephant!" And the dog had swallowed a squeaky elephant.
Oh.
And the picture, because the dog hadn't eaten anything else, and so there was a beautiful gas pattern surrounding the elephant, and you can see a perfect lateral, tiny little elephant, and then you could see a perfect dorsal shot of the elephant. And so, it was a regular, we did an exploratory surgery and we moved it, but just being able to say, oh my gosh, like that's an elephant, was just one of the funniest things.
You have to really love the science. I hear the passion in your voice to be able to say, that beautiful pattern, all that stuff.
I love what she does. I love that. I love you for that, Shae.
So this is our little friend, but here was the lateral view. And so you can see the gap in the stomach outlining it. And then this is the dorsal ventral view.
That tail certainly helps. The foot, the tail, you can really see them.
Yeah.
And then you see his trunk. Oh, I bet that tech just went, oh my God.
Yeah, it was pretty cool.
That is pretty cool, actually. But isn't it crazy? How did that dog swallow that sucker? That's a feat to be awarded for. Like, they give awards for who swallows the craziest thing. But I would never, because I would just encourage people to shove crazy stuff down their stomach.
It did squeeze down into a very small, like it was full of air, so it was hollow. So that kind of helped.
Yeah, I could probably swallow that.
I bet you could, Larry.
If somebody's thinking about becoming a veterinary technician and going to school for it, what should they know coming in? What should they know about themselves?
I think the biggest thing is that our job is not petting puppies and kittens all day. We work in the medical field, so you're going to be dealing with medical procedures. You're going to be dealing with urine and feces and blood and vomit and all of that. Also, it's a high science, high math field, and that's definitely not to scare anybody away. I teach medical math in our program, and my goal in teaching math is to make everybody feel comfortable with doing the math that we have to do and working with the sciences. So it's definitely not to scare anybody at all, but to really understand that you're committing to life-saving procedures. And so to take that kind of severity of it, and I think that's one of the things, especially early on, is trying to explain to students, hey, and we start from like the beginning and just reminding them, when you get into anesthesia, you're going to have lives in your hand. You really need to pay attention to that and make that a priority. And one of the things that I found is the vast majority of students, the further they go, the more interested they get in all of these crazy, weird things that we see. And so they talk about, oh, I saw this case and I saw that case. And I've had multiple students say, yeah, I'm not really allowed to talk about what I do anymore because we get excited about the weird and gross stuff. And family members are like, ew, I don't want to eat now. Yeah. I've had people who are like, I'm going to try and gross you out. And I'm like, bring it on, buddy. Here, let me grab a bowl and eat something while you're trying to explain something disgusting to me. Let's see if I can puke. And it never works.
It'll never work for you, Shae. You have mastered the art of wrapped around grossness. I like it.
Yaneli, what would you want to add to that? You said that you didn't even know you were going to be a veterinary technician 2 years before you entered the program. What happened?
I actually had a friend in my undergrad who is now living up in Oregon who went into a veterinary technician program. So that kind of piqued my interest. And I was looking into programs and found Foothill, and that's part of the reason why I moved to Northern California is because Foothill was affordable and it looked like a really good program. And so I got into the program and I started working at the hospital, and I learned the more time I spent working in a clinical setting, the more I realized that it's not a cushy job. And I learned more about being a vet tech and that it meant you get peed on a lot. You have to, like Shae was saying, you have to deal with a lot of fluids, and a lot of it is it's a dirty job, but it's really rewarding.
It is, I'm sure, so rewarding for you, especially early on. I believe that reward is what keeps you going. But I'd like to ask a very important question of both of you regarding that topic. So being a vet tech is hard and is emotional. It is such emotional work, and you have to be able to have some kind of emotional intelligence wrapped around your reactions to everything that walks in the door. And I understand this completely, as I've had numerous clients call me and say, oh my gosh, my dog just ate my shoe. Like, how do you get them to the vet without, or my dog just got bit by the dog across the street and it's bleeding from its side and its face. Like, you have to keep your emotional self intact to be able to help that 911 situation. But how do you inspire yourself to keep going? Because not every day is rosy. Not every dog lives. Not every cat survives the attack or the car trauma. So do tell me what, whoever, Shae, actually, Yaneli, why don't you go first? What keeps you inspired to keep going strong?
Yeah, so I'm not, like I said, I haven't been in the field super long, so I'm not quite, I'm still like bright-eyed, bushy tailed. But something that really, like, we do have really sad cases and really intense cases that come in, and something that really does keep me going is seeing how my coworkers react to, and like the care that they put into their job. As an example, we had a dog maybe a couple of months ago come in that was seizuring, circling, head pressing, and it was a really, really sad case, vocalizing. And then one technician in the busy environment that we work in took the time to shut off all the lights, grab the dog, like surround it with blankets, and just hold it while she was doing some computer work, just so that it felt safe and that it felt like, you know, there's a body there, someone that cares. And like that kind of detail gets me, and I'm like, well, we're all in this together. Like, this is what we're here for. Like, we're here to provide care to animals that are scared and animals that are injured and animals that don't know what's going on. Like, if we don't, who will? And so that's kind of the main thing that keeps me going.
I'm hearing the same kind of compassion I hear from people who are working with humans in medicine. You know, I need to have compassion and love for people in the case of human medicine. And I'm so stoked to geek out on science, and not just that is one word, but that is a gazillion different disciplines.
And Shae, I'm assuming that I can guess your answer because you've segued from the actual vet itself to teaching, although I know you're in the segue. So I'd love to hear what you have to say about what keeps you inspired.
Yeah, absolutely. I think I touched on it before, just the excitement of our students. And I also think it's just a love of the field. We all get into this field because we love animals. And I've had numerous people who said, you know, I could never do what you do because I can't see animals hurt, or I can't, you know, see them in pain. And I think for me, what's even stronger than the anguish and the sadness of seeing them hurt and seeing them pain is the ability to help them out of that and to take care of them so they're no longer in pain, and to work with them so they're no longer scared. So I think that really is what does it for me, is the ability to just be able to not necessarily think about what's happening with this animal in the moment, but how are my actions going to improve the quality of life of this animal, and then in return the quality of life of the owner. You know, I've had multiple owners, both when I was working full-time as a shelter tech, and also owners from the emergency clinics, just express how grateful they are that you're there to answer their questions and to talk to their animals and to treat them the way they would, because they can't be there.
So true. And is there I'm going to ask one more very serious question. You don't have to answer it with more than one or two words. Have you ever worked for any veterinarians that you weren't happy with?
Yes.
Thank you. I just wanted to hear that.
So here are some photos that you all send, and I've got to ask a question about this first one, Shae. Is it a Halloween costume, or are we prepping for something here?
No, so this little one had eaten something, and I believe it was grapes, because that's what everybody's eating grapes. So one of the things that we do is we attempt to make them vomit. And then the problem with grapes is there's just an unknown toxicity level with dogs. And so the next thing you want to do is give them activated charcoal, which will help absorb the toxin in their stomach. The problem is activated charcoal is black because it's charcoal and it gets all over the place. So one of the things that we do, we have pee pads or wee-wee pads that we can put in their kennels, so if they urinate, it doesn't get all over them. So one of the things that we do is kind of make a cape for them and put the pee-pee pad over their head to help keep them clean. And so I was doing that, and one of my coworkers was like, "Oh my gosh, it's dog Teresa." So they're like, "I have to get a picture." So they took a picture of me with my little dog Teresa friend.
Oh, it's so cute. Look at that little face. I know.
Yaneli, tell us about this photo.
That was a dog. I forgot what he'd gone in for, but he was extremely anxious and was just really yappy, which is understandable because he's in a strange place and he doesn't feel great. But we had other patients that were sick, and so we were trying to find ways to keep them quiet. And ultimately, I just stuck him in a baby Bjorn because we noticed that when he was held by people, he would quiet down. So I just carried him around while I did other stuff.
Is he a Bichon or a Maltese or
I
a
don't remember.
some kind?
Yeah, I'm not sure. I think he was like a mix.
Yeah, it doesn't surprise me. That happens quite a bit with that breed. They're carried around a lot, and they get very anxious and needy and have social anxiety disorders, usually because they're not socialized as much as they could be or should be. So I get it. But what a cute, that's cute.
Yaneli, I love the Wonder Woman pose. You're just one tiara short of a Wonder Woman. All right, so now what's going on over here?
Oh, that was I think we were just waiting to do a physical exam.
Yeah.
And he was pooped.
He was pooped.
Yeah.
Yeah. It's a sweet photo.
So cute.
And then this looks like you're under anesthesia.
Oh no, that's actually my cat. My cat Ruby, the one that was.
Oh.
She's here.
Yeah, that's.
Was that dental work?
We were just doing. I think we were doing like an integument exam, so just trying to get in between the digits. But my cat had given blood earlier that day, so she was still a little sedated. And she was presented with baby food, which, as you can probably tell, she enjoyed a lot.
So
you're right.
You gave blood, so you brought your cat in to give blood, so you'd have some blood in the blood bank for other cats when they came in. That's so amazing, and I wish more people did that.
I didn't even know about that, but of course, makes sense.
All the pets, I'm sure, bring their dogs in and cats, and it's like bloodletting. It's very healthy for them.
Mm-hmm.
And they get a nice treat after.
Nice.
Mm-hmm.
That's baby food.
So, if I'm understanding this correctly, you bring in your own animals into the school? Is that how you do part of the training?
That's what we're doing right now because of the whole situation with the pandemic.
Right.
Makes sense.
Mm-hmm. So, Shae, you've probably seen the field evolve some already. You know, in the year that in the years that you've moved from student to veterinary technician to now veterinary technician professor. How's the field evolving? Is it becoming more sustainable? Talk about the field.
Yeah, so I've been in the veterinary field for over 20 years, and it's just a huge change. I think the level of medicine is just improving dramatically. The understanding of our patients, you know, when I first started in the field, we were just getting out of this mentality that pain was good for animals because it kept them quiet and it kept them sedate after surgery. To now we understand that multimodal, or the addition of multiple different pain medications to attack the pain at different sites, is far more productive and far more beneficial for the patients. So absolutely, Yeah, 100%. I also think that depending on the clinic, the use of technicians has just branched out. When I first started working in the field, it was, you draw blood and that's it. We didn't really collaborate with the veterinarians. They didn't want to know our ideas because they were doctors and they knew everything. And we were just lowly technicians. And definitely over the years, I've had the privilege, sorry, I have Barnaby hair all over my nose. I've had the pleasure of working with multiple doctors who, instead of seeing it as like I'm God and you're just my helper, really see it as we're a team. And so really appreciate and encourage their technicians to help them, catch things that they may not catch, and see things that they may not see. I even had, when I was working in the shelter, the veterinarian that I worked with, she had been in shelter medicine for quite a while and I'd been in general practice. And so she was very excited. She was like, there's a lot of things that you've seen that I haven't seen. And she would ask me about, different x-rays or different things. We have one of our co-workers, one of my co-teachers who works at the emergency clinic, and she's been doing ultrasound for years. And so she'll have doctors who will ask her, hey, what do you think about this? And what do you think about that? So they really are starting to utilize us as what we are, as a true part of the team. And then the sad part of it is that there are doctors that don't. I think that's one of the challenging things, like in every profession. Every profession, you're going to have kind of bad apples. And so you do have veterinarians who don't really appreciate what we have to offer, who don't think of us as a really vital, important part of the team. I think that's definitely decreasing. And I think we're very lucky in our area. Doctors really are appreciating what we're doing and valuing us, and definitely valuing the education that our students are getting.
Okay, what you're saying are such powerful words. They're so spot on, and you are just brilliant. I think that any veterinarian that has worked with you in the past is lucky to have had you. And anyone that has treated you improperly, bad karma, and I pray for that. So thank goodness you were there to at least help them see some light. There is so much value in vet techs because you see the patient at all moments. You're monitoring them. The vets are bouncing from patient to patient. So you see the nuances that the doctors don't see, or the veterinarians don't see, just like the nurses in a hospital see the nuances about a human patient that the doctors don't get a chance to see, and they rely on you. So why they wouldn't treat you as a great team member? I'm glad that you're instilling in so many young vet techs just as all that you touch, those nuances, so that they can help so in so many grander ways and have the confidence to do so. So thank you, Shae.
Yaneli and Shae, we love to do shelter shout outs on this show. And I think each of you have had the opportunity to work with shelters, not just as a fan of shelters, but also in medicine. Is there a shelter you'd love to give a shout out to today?
Go for it.
Before the pandemic, we got all of our animals with San Jose, right, Shae?
Yeah.
So I'm super, super, super grateful to them because we are able to we're able to learn so much about animals and sort of like we wouldn't be able to do our jobs and learn if we aren't able to feel the bones on a living, breathing animal and sort of get a sense of how they act and so without them we don't really have a basis for learning, I guess. So I'm really, really grateful.
So shelters in general, you're able to touch the animals more than in other environments. If is that what I'm understanding?
Or rather, in the program, in terms of learning, in terms of having because without the animals, like we would have to, it would all be theoretical rather than practical work and like actually gaining technical skills. So without actual animals, we're not able to get those technical skills.
And it's at a shelter where you can do that.
Yeah, it's from the shelter.
Is there a shelter in particular that you want to give a shout out to?
It's the San Jose Animal Shelter. Yeah.
San Jose Animal Shelter. Fantastic. And Shae, over the years, you've had the opportunity to work in medicine with a number of shelters. Is there a shelter you want to give a shout out to today?
Absolutely. I just want to kind of piggyback on what Yaneli said. So one of the things that we do is we partner with the San Jose Animal Care Center, and they actually have us do some of their spays and neuters. So the animals will actually come to the program, and our students will, under the direction of the veterinarian, hand in hand with a registered veterinary technician instructor, will kind of work through the process of monitoring the animals and stuff. And so it's a really wonderful thing. We are able to provide the shelter with free spay and neuter, and then the shelter is able to provide us with really good hands-on care. And we've actually had numerous animals adopted out from our students seeing and working with these animals with the San Jose shelter. So that's super awesome.
That is wonderful.
Yeah.
This show is all about gratitude and blessing. Is there somebody in your life or in the world who you'd love to give a shout out to?
I want to give a shout out to Shae and all the instructors at Foothill, because and the RVTs that I've met have always been willing to answer my questions and are always excited about teaching. And it's just so much more inspiring when people take the time to answer your questions and don't sort of write you off. So I really, really appreciate the RVTs.
And RVTs are registered veterinary technicians?
Yeah, sorry.
Yeah, that's okay. It's you're educating me here on National Vet Tech Week. So if I'm to fill in a gap here, you can become a veterinary technician, and then you can become a registered veterinary technician?
So after going through the schooling and taking the licensing tests, here in California, you're known as registered vet technician. So that's the title that you get once you're done with your schooling and the licensure. Yeah, but in other parts of the country, there's different terms. There's licensed veterinary technicians. And, yeah.
There's a vet tech assistant as well. Is there not a vet tech assistant designation?
Got it.
It's like there's a nurse, a certified nurse's assistant. I believe there are people I've met that are vet tech assistants.
Yeah. So usually at least in California, they're considered unregistered assistants. Sometimes they'll be called tech assistants or vet assistants. Those are students who are individuals who either are going to school to be registered or who are just working in the field. But there is legal distinction between what they're allowed to do and what we're allowed to do as far as the Veterinary Medical Act, but it's just a different level of training and education.
And most of the ones I've met are in school or are younger and wanting to figure out what they want to do. So they're assisting a vet tech to decide, it's shadowing. They're working in the veterinarian's offices, but they have absolutely no authority to do anything, nor do they administer any tests. They just assist the veterinarian technicians.
Yeah, absolutely. Well, and I think what you brought up is a really good point for individuals who are interested in working in the field. Volunteering at a shelter or volunteering at a vet clinic really will give you an idea of what it means to be a technician. And I think that kind of ties into my gratitude. It may be a little bit unconventional, but my gratitude goes to those individuals, the little boys and girls, the ones in elementary school or middle school who love animals and who really want to make a difference in their life, and who maybe don't really understand how or what they can do. And my hope is that, you know, they'll see this as this is an amazing way to really save animals' lives. And so just the excitement. One of the things I do is I go out and I do what is it called when you go?
Internship?
No,
Outreach.
Outreach. Thank you. I have a problem with words sometimes. My students all get it.
You got a few terms in your head there, huh?
So I go out and I do outreach pretty frequently, and I love seeing the excitement in these kids' faces. I bring Barnaby; he's like the unofficial mascot of the program.
Can we get a Barnaby? Can we get a Barnaby sighting?
Yeah.
I love it.
This is Mr. Barnaby. He's 12 years old, and he has been, every year he volunteers to come and have the students practice with him and work with him.
He's a Jack Russell mix.
He is, to my best ability, a Jack Russell Dachshund mix. But he has amazing temperament. So I bring him up to all of the outreach, and it's just awesome to be able to see the excitement in the little kids' eyes, and, you know, tell them a little bit about what we do.
Nice. Hi, Barnaby. Thank you. Woof, woof.
And tell us about Ruby.
Ruby, she's about 2 years old. She's just a tabby. She's a blood donor, which is
Beautiful eyes.
Amazing.
This is her little blood donor
Shave's patch.
memento, yeah.
Oh.
Oh, look at those eyes. Wow.
Does she like catnip? I'll send her some catnip.
Her brother really does.
So beautiful. How old is she?
She's 2.
Well, I love them both, the moon and the stars.
Well, Yaneli Guterrez and Shae St Onge-Cole, thank you so much for being on Dog Hugs and helping us celebrate National Veterinary Technician Week.
Thank you both.
Thank you for having us.
Keep up your wonderful work, and keep up inspiring all those pets to get well and stay well.
What a great interview. That was really, really special. Yeah, you want to unmute yourself.
Right, I thought I did. Sorry. It brought back a lot of memories of when I've had to talk with those vet techs on the phone. And it just really, I'm so much more connected with them. Every time I speak with the vet tech, it's an amazing experience, and I love them. So happy National Vet Tech Week, everyone.
Thank you so much for joining us, everybody. And we've got a big show tomorrow with Robbie, and for our From the Cat Box, and back with you again for Dog Hugs on Thursday. So thanks again,
Big
everyone.
hugs, everybody.
Cheers.
Bye, everybody.